1.
22.2 Exercise prescription. What is an exercise prescription? An exercise prescription is a specific plan of fitness-related activities that are designed for a specific purpose, which is often developed by a fitness or rehabilitation specialist for a client or patient. The exercise prescription scheme provides opportunities for specific groups. Components of an exercise referral include the type of exercise, specific workloads, duration, frequency, intensity guidelines such as target heart rate and estimated rate of perceived exertion, and precautions regarding certain orthopedic concerns or comments. There are two different contraindications, relative and absolute. So, relative is either an event or substance that could cause life-threatening situations, and absolute is when the event or substance benefits outweigh the risk. But therefore, factors need to be put into place um, to minimize that risk from occurring to keep it safe. So, a contraindication is actually a specific situation in which a drug, procedure, or surgery should not be used, as it can prove to be harmful towards the patient. So you obviously got relative that you just don't use at all because it is life threatening, and absolute where you can minimize the risks from happening. So my first population is old people. So for these, the contraindications are high blood pressure, arthritis and joint pains, and dementia. So exercises that must not be done for these for this population is changing of levels, such as exercise doing burpees, because with our high blood pressure, like changing of levels and isometric exercises can actually increase blood pressure even more, and then this puts even more strain on the heart because you're changing from like high to low or low to high. Also, any exercises done over the head can also contribute to high blood pressure. And for arthritis, I said that no impact exercises should be done, so running on concrete, like contact sports, as this can cause a lot more stress on the bones and joints that are adding to what's already there. And also no exercises with heavy weights, especially for the patients with dementia and arthritis, because it can actually cause even more problems with the bones and joints. But also, if you have dementia, you might forget how to properly do the technique when you're lifting heavy weights, so it can actually cause even more injuries than you set out for it to be. So for the prescription, first of all, I would prescribe aerobic, non-excessive weight-bearing exercises. This could be anything from swimming to brisk walking to cycling. So, like when you're walking, you walk on soft grounds like sand, grass, that kind of thing. Um, I would recommend that this is done 3 to 5 times a week, where they're working 20 beats up from their resting heart rate. Just so you're working harder than what you would normally be, but you're not working too hard to put any stress on like your high blood pressure, your heart kind of thing. Um, so in other words, they should be working around 40 to 70% of their maximum heart rate. I'd also try and say that they do this kind of exercise 20 to 30 minutes a day. So this would really be prescribed for both coronary heart disease, but also like people with high blood pressure. Um, as like aerobic exercises can actually help not only like strengthen your heart, but also strengthen your body, so it's able to help lower the high blood pressure. I would also prescribe them to do flexibility and resistance training to both help with strengthening of the bones and also just to help with day-to-day life, such as putting their shoes on. For resistance training, I would say for them to use either light machines or free weights, depending on ability and mobility, or even some kind of hydrotherapy. This should be done 2 to 3 times a week, 10 to 15 reps a time, until technique is lost, and at least 8 to 10 different exercises, or one set of each. Uh, it would be said that they would need to be doing each exercise for about 20 to 30 minutes at a time. So the whole point of resistance training is to kind of help strengthen up your bones, your joints, and if you like swimming, so like hydrotherapy, you're actually acting towards a resistance, but you don't feel it as much on your bones. With like free weights, you start with the light weights, you're just helping to strengthen up the muscles around your bones, which then can lead to help increasing like your bone, like how strong your bones are as well. For flexibility training, I would suggest they would do like simple stretches of the major muscle groups, so like doing lunges, doing like if you have mobility problems in your shoulder, then you'll do the exercise where you bring your hand over the course of your body and hold it there. Just something to keep uh stretching of the major muscles to keep them moving to stop them from seizing up or losing their size. So I'd say that they should do this about 2 to 3 times a week, taking each stretch to the point of discomfort and holding each stretch for 10 to 15 seconds. Um, yeah, so the next population is pregnant women. So for pregnant women, their contraindications are hormonal changes, which can cause fainting, reduced strength, especially in pelvic muscles, and increased heart rate. So exercises to be kept away from in is exercises of changing levels, so going from high to low or low to high quickly, such as burpees, due to the uh just due to like the hormonal changes. So if you're feeling faint already, you don't exactly want to be going from different levels because it will cause you to become even more faint or actually will faint. Also, staying away from heavy weights as well as high impact, high intensity sports. Heavy weights must be kept away from as well because bones become weaker, especially at the hip joints where the joint is actually loosening, therefore loosening to be able to give birth to the baby, therefore minimize any more injuries. Stay away from like heavy squats or and also high intensity sports as well. Stay away from because of your already elevated heart rate. You can't do high intensity sports or exercises because these are used to raise your heart rate, and you don't want to raise your heart rate to the extent where it can cause major problems for both you and the baby. So first of all, I would suggest that they do swimming or cycling for around 3 to 5 days a week for 20 to 30 minutes a time with 40 to 70% of maximum heart rate. I suggest this because it's low impact and it's not high intensity, so this will help with or the already elevated heart rate, but also working against this resistance, like in the water or continue to do cycling, also help keep muscles and joints strong and working properly. I would also recommend that they do yoga as flexibility training in order to maintain muscle tone and flexibility, and also improve posture, especially when the pressure on your spine and muscles is compromised due to the baby growing. Therefore, I'd recommend 2 to 3 sessions a week. Do stretches of yoga workout to the point of mild discomfort. Hold each for 8 to 10 seconds and repeat movement 3 times or stretch 3 times. If anything, for pregnant women, I'd probably focus more on the pelvic and spinal muscles than anything, just because these become weaker because the amount of stress they are having put onto those areas of the body. I would also say that they do some weight training. This can be done to maintain strength and toning of the muscles. However, light weights or body weight must be used, as this will have as big an effect as using big weights. Wouldn't recommend using big weights, obviously, because of the reduced strength. Also, how like delicate your bones will be as well. I would recommend doing light weights training for about 2 to 3 times a week with 10 reps and 3 sets. I would also recommend trying to do 8 to 10 different exercises. The final population is obese people. So type 2 diabetes is a contraindication for them. Also shortness of breath and osteoarthritis.